Ever looked at an ECG and felt a wave of panic wash over you? Maybe your heart raced a little faster and you wondered if you'd ever be able to make sense of those mysterious lines and spikes. You're not alone. Electrocardiograms, those squiggly lines on a screen, can seem like a foreign language. For many students and even seasoned doctors, the first encounter with an ECG can be intimidating. But here's the secret. They're the key to unlocking the heart's secrets, revealing hidden rhythms and potential dangers that could save a life. Mastering ECGs is essential for any aspiring doctor, especially for crucial exams like NEET PG and INISET. It's not just about passing exams. It's about building confidence in your clinical skills. Think of an ECG as a window into the heart's electrical activity, a live map of each beat. Every spike and dip tells a story about what's happening inside the patient's chest. It's like listening to the rhythm of a drum, but instead of a musical instrument, you're hearing the symphony of life itself. Each pattern, each interval, is a clue waiting to be discovered. And just like any language, once you learn the basics, the rest falls into place. Suddenly, what once seemed impossible starts to make sense. In this guide, we'll demystify ECGs, breaking down complex concepts into easy-to-understand steps. We'll walk you through the essentials, so you can approach any ECG with confidence. We'll use mnemonics, real-life examples, and exam-focused tips to help you conquer this vital skill. You'll learn how to spot the most important patterns and avoid common pitfalls. With a bit of effort and practice, you'll be reading ECGs like a pro in no time. The more you practice, the more natural it will feel. So buckle up, grab your stethoscope, and get ready to conquer the world of electrocardiography. Your journey to diagnosis and exam success starts right here. Imagine you're setting up a surround sound system for your heart. Instead of speakers, we use electrodes. These small sticky patches pick up the heart's electrical signals from different angles, giving us a multi-dimensional view of its activity. The standard 12-lead ECG uses 10 electrodes placed on the chest, arms, and legs. Don't worry, there's a handy mnemonic to remember the placement. Smoke over fire, clouds over grass, and chocolate is for everyone. So smoke, which is black, goes over fire, which is red. That means black electrode on the right arm, red on the left arm. Next, clouds, which is white, over grass, which is green. White electrode on the right leg, green on the left leg. And chocolate, which is brown, is for everyone. The brown electrode goes near the heart, on the right sternal border, fourth intercostal space. The chest leads, V1 to V6, are placed in a specific order across the chest, capturing the heart's electrical activity from different angles. Now that we've wired up our patient and the electrodes are in place, it's time to dive into the fascinating world of heart signals. Let's decode what these squiggly lines on the ECG actually mean. The ECG tracing shows a series of waves and complexes, each one representing a specific electrical event in the heart's cycle. These patterns are like a secret code, revealing how the heart is functioning with every beat. The most important ones to recognize are the P wave, the QRS complex, and the T wave. These three are the key players in understanding the heart's electrical activity. Remember them with this simple phrase, pee on the grass, then eat. It's a quirky mnemonic, but it really helps you recall the order of the waves. The P wave represents atrial depolarization, which is the electrical activation of the atria, the heart's upper chambers. Think of it as the atria getting ready to squeeze blood into the ventricles. This is the first step in the heartbeat, setting everything in motion. The QRS complex represents ventricular depolarization, the electrical activation of the ventricles, which are the heart's lower pumping chambers. This is the heart's main pumping action, sending blood out to the body. It's the most dramatic part of the ECG and usually the largest spike you'll see. The T wave represents ventricular repolarization, the electrical reset of the ventricles, preparing them for the next beat. Think of it as the ventricles relaxing after a hard workout, getting ready to start the process all over again. Each wave and complex has a normal duration and amplitude. Measuring these carefully helps us spot any abnormalities in the heart's rhythm or structure. For instance, the PR interval, which is the time between the start of the P wave and the start of the QRS complex, should be between 0.12 and 0.20 seconds. This interval tells us how well the electrical signal is traveling from the atria to the ventricles. Any deviation from these norms could indicate a problem, such as a heart block or arrhythmia. That's why understanding the PQRST waves is so crucial. They're the foundation for interpreting every ECG you'll ever see. Sometimes, the heart's rhythm goes haywire, like a conductor losing control of an orchestra. The steady, reliable beat that keeps us alive can suddenly become unpredictable, and this can have a range of effects on the body. When the heart's electrical system misfires, it can cause the heart to beat too fast, too slow, or in a completely disorganized way. These rhythm disturbances, called arrhythmias, can range from harmless to life-threatening. Some arrhythmias may cause no symptoms at all, while others can lead to palpitations, dizziness, fainting, or even sudden cardiac arrest. Recognizing them on an ECG is crucial for timely intervention and treatment. Let's explore 3 common ones you'll encounter, each with its own unique pattern and clinical significance. Understanding these will help you quickly identify them in real-life scenarios. First, atrial fibrillation, or AFib. Imagine a room full of people all talking at once. That's what's happening in the atria during AFib. The electrical signals become so disorganized that the atria can't contract properly, leading to a chaotic rhythm. The atria quiver chaotically instead of contracting effectively, resulting in an irregular rhythm on the ECG. This means there's no predictable pattern to the heartbeats, making the pulse feel erratic and uneven. The key here is irregularly irregular. No 2 beats look the same. This is a classic hallmark of AFib, and it's important to spot it quickly as it increases the risk of stroke and other complications. Second, ventricular tachycardia, or VT. This is a dangerous rhythm where the ventricles take over and beat too fast, like a drummer going rogue on a solo. The heart can't pump blood effectively at these high speeds. The ECG shows wide, bizarre QRS complexes in a rapid succession. These wide complexes are a sign that the electrical signal is not following the normal pathway, but instead is originating in the ventricles. Think of it as the heart racing out of control. If not treated promptly, Vermont can quickly deteriorate into ventricular fibrillation, which is life-threatening and requires immediate intervention. Third, AV blocks. Imagine a wall between the atria and ventricles delaying or blocking the electrical signal. This interruption can slow down the heart rate or even cause missed beats. That's what happens in AV blocks, resulting in a delayed or absent connection between the P wave and the QRS complex. Depending on the severity, this can cause anything from mild fatigue to severe dizziness or fainting. Think of it as a communication breakdown within the heart. Recognizing these arrhythmias on an ECG is a vital skill for anyone involved in cardiac care, as early detection can save lives. A heart attack, or myocardial infarction (MI for short, is a life-threatening emergency that happens when blood flow to the heart muscle gets blocked. The ECG, or electrocardiogram, plays a super important role in rapid diagnosis and treatment here. Ischemia, which means reduced blood flow, shows up as ST segment depression on the ECG. So just imagine a rope being pulled down from the baseline. That's kinda what ST depression looks like. On the other hand, infarction, or a complete blockage of blood flow, usually presents as ST segment elevation, what we call STEMI, in specific leads, which actually tells us the location of the blockage. Think of it as a mountain peak rising from the baseline. For example, ST elevation in leads 2, 3, and AVF suggests an inferior wall MI, while ST elevation in V1 to V4 points to an anterior wall MI. Oh, and don't forget the mnemonic PALS for anterior MI leads, V1 to V4. Just think P for precordial leads. Just like any muscle, the heart can become enlarged or hypertrophied when it's forced to work harder over time. This is often a sign of underlying conditions like high blood pressure. The ECG can actually provide some important clues about ventricular hypertrophy. For left ventricular hypertrophy, or LVH, you want to look for tall R waves in the left-sided leads. So that's leads 1, AVL, V5, and V6, and deep S waves in the right-sided leads, like V1 and V2. You can kind of think of it as the left ventricle casting a larger electrical shadow on the ECG. For right ventricular hypertrophy, or RVH, look for a tall R wave in lead V1 and a deep S wave in lead V6. It's almost like the right ventricle is taking center stage in the V1 lead. Now, let's focus on some high-yield ECG tips specifically for your exams. When it comes to potassium imbalances, for hyperkalemia, which means high potassium, look for tall peaked T waves. You can imagine the T waves are trying to touch the sky. For hypokalemia or low potassium, look for flat or even inverted T waves and those prominent U waves, which are those little waves after the T wave. It's like the T waves are so tired, they need to make a U-turn. For lead localizations, just remember, for a lateral wall MI, check leads 1, AVL, V5 and V6. Think L for lateral. For an inferior wall MI, it's leads 2, 3 and AVF. Think I for inferior. And for a septal wall MI, focus on leads V1 and V2. Think S for septal. Remember, practice really does make perfect. The more ECGs you analyze, the more confident you'll become in recognizing these patterns. Let's quickly recap the key mnemonics and tips we've covered so far. For electrode placement, remember, smoke over fire, clouds over grass, and chocolate is for everyone. For the PQRST waves, use P on the grass, then eat. When it comes to arrhythmias, keep in mind, AFib is irregularly irregular. Vermont has wide, bizarre QRS complexes, and AV blocks have a delayed or even absent PR connection. For MI leads, think pales for anterior MI, that's V1 to V4. For hypertrophy, LVH means tall R waves in left-sided leads, and RVH means a tall R wave in V1. For potassium, hyperkalemia gives you those peaked T waves, while hypokalemia shows flat or inverted T waves and prominent U waves. Congratulations! You've now embarked on your journey to ECG mastery. Remember, the key to success is practice. Analyze every ECG you can get your hands on. Test yourself with practice questions, and don't be afraid to ask for help when you need it. The world of electrocardiography might seem daunting at first, but with dedicated effort and the right approach, you'll crack the code and unlock its secrets. Before you know it, you'll be reading ECGs with the confidence of a seasoned cardiologist. So go forth and conquer those ECGs. And if you have any questions or need further clarification, feel free to ask. Happy learning.